Hello everyone, welcome to Study with Amfeen. Hi, I hope all of you are doing well. So today we are going to start one of the most important topics in anatomy, which is musculoskeletal system. So before we learn about bones, joints and muscles separately, it is very important to understand this system as a whole. Okay, look at the picture on the right side. You can see the skeleton on one side and the muscle on the other side. So this structure works together to support our body and help us move. So in today's lecture, we'll understand the basic concepts of the musculoskeletal system, and we'll also learn anatomical position, directional terms, body planes, and body movements. So these topics are very, very important for your university exams as well as your nursing practice. So let's begin. Now, the first question is, what is the musculoskeletal system? So, in simple words, the musculoskeletal system is made up of bones, muscles, and joints that work together. Okay, think about your own body. Can you stand without bones? No. Can you move without muscles? Again, no. Right? So, both bones and muscles are needed for movement. So, now look at this picture. This is the bone. Attached to the bone is muscle. And the white structure connecting the muscle to the bone is the tendon. Okay, here is the white structure which is connecting the muscle to the bone. So when the muscle contracts, it pulls the tendon then pulls the bone. This is how movement happens. Okay, so remember, bones give support, muscle produce movement, and joints allow movement between bones. Okay, so this is the basic idea of the musculoskeletal system. So now let's learn about the different parts of this system. What are the components? So the first component is bones. So bones form the hard framework of our body. Okay, they give our body shape and support. Next are muscles. Muscles contract and relax to produce movement. Okay, now let's look at the picture. This is the joint. A joint is the place where two bone meets. Inside the joint, we have a cartilage. Cartilage, what is cartilage? Cartilage is a smooth tissue, okay, that covers the ends of the bones, as you can see in the picture. So it reduces friction and helps the bone move smoothly. Cartilage function, I'm saying. So it is a smooth tissue that covers the ends of the bone, and it reduces the friction and helps the bones move smoothly. So now look here, this white structure are called tendons, as we have seen before. So tendons connect muscle to the bone. So finally we have ligament. Ligament connect, here is the ligament. Ligament connect one bone to another bone. Okay, a very easy trick to remember is ligament connect bone to bone, tendons connect muscle to bone. Okay, students often get confused between these two. So make sure you remember this difference. Okay, let's move to the next slide. Now, let's understand the functions of the musculoskeletal system. The first function is support. So bone give shape and support to our body, as I've told you already. Without bones, our body would not be able to stand, right? So the second function is movement. So pull, muscle will pull on bone to produce different body movements like walking, lifting, running, jumping, etc. Okay. The third function is protection. So how bones will protect? The main organ, the vital organs like heart, brain. Okay, bones protect important organs. For example, the skull will be the skull will protects the brain. The ribs protects the heart and lungs, and the vertebral column protects the spinal cord, right? So another important function is blood cell formation. So inside some bones, there's a soft tissue called bone marrow, as you already know, I think. So this bone marrow will produce red blood cells, white blood cells, and platelets, right? So finally, bones store some important minerals such as calcium and phosphorus. So these minerals help in keeping bones strong and healthy. So these are the main 5 functions that you should always remember. Okay, remember the function. Now let's see why this topic is important for nurses. As future nurses, you will use this knowledge every single day, right? So the first point is patient mobility. So many patients cannot move on their own. है ना? As nurses, you should know how to lift and turn patients safely without causing injury, without causing any injury. Okay. So the next point is preventing complications. So if a patient stays in bed for a long time, they can develop some bed sores and stiff joints. है ना? So knowing the musculoskeletal system helps you prevent these problems. The third point is physical assessment. So when a patient comes with pain or swelling, you should know which bone, muscle, or joint may be affected. Okay. Finally, this knowledge is very important for nursing procedures like intramuscular injections. Very important for nurses to know this. Okay. For example, before giving a deltoid intramuscular injection. So you must know exactly where the deltoid muscle is located. Without anatomical knowledge, giving an injection safely will become very difficult. Okay, that is why anatomy is one of the most important subjects in nursing. So far we have learned what the musculoskeletal system is, its components, its function, and why it is important in nursing. Now, before we study bones and joints in detail, we must first understand a very important concept in anatomy called the anatomical position. Okay, so in anatomy, doctors, nurses, and every healthcare professional use one standard body position. This is called the anatomical position. So, why do we need a standard position? So, imagine one person is lying down, another is sitting, and another is standing. Okay, it would become confusing to describe body parts. To avoid confusion, everyone use the same reference position. Okay, now look at this picture. The person is standing upright. The face is looking straight ahead. The arms are relaxed by the sides of the body. Now notice the hands carefully. The palms are facing forward. Okay, this is very important point and students often forget it in exams. So finally, the feet are flat on the ground and facing forward. Okay, remember this 4 point compulsorily. Whenever you hear the term anatomical position, this is the position you should imagine. Standing upright, faces forward, palms facing forward, feet parallel. Okay. Now that we know the standard body position, let's learn the language used to describe different body parts. So directional terms. Doctors and nurses usually use special words to describe the location of the body parts. So these are the directional terms. Let's start with the first two, that is superior and inferior. Superior means towards the head or above. For example, the head is superior to the chest. Now look at the downward arrow. Inferior means below or towards the feet. For example, the knees are inferior to the hips. Now let's move to the side view. Anterior means towards the front of the body. For example, the chest is on the anterior side, right? Towards the front of the body. Posterior means towards the back of the body. The spine is on the posterior side. So these words help healthcare professional describe the body accurately. So instead of saying in front or behind, we use these terms anterior and posterior. Now let's learn 4 more important directional terms. First, look at the dotted line here. Okay, look at these dots, this dotted line in the center. So this is called the midline. Now medial. Medial means closer to the midline. For example, the nose is medial to the eyes. Now look at the this blue arrow. This blue arrow pointing away from the center. Right, so this is lateral. Lateral means away from the midline. This is the midline. Lateral. Lateral means away from the midline. For example, the ears are lateral to the nose. Next are proximal and distal. These terms are mainly used for arms and legs. Okay, remember this. Proximal means closer to the trunk or point of attachment. So, trunk of the body, you know, no? So, proximal means closer to the trunk or point of attachment. For example, the shoulder is proximal to the elbow. Okay, distal means it's opposite. Proximal's opposite is distal. So distal means farther from the trunk. For example, the fingers are distal to the wrist. Okay, the fingers are distal to the wrist. Always remember, proximal means near and distal means far. Okay, so if I ask you, is the wrist proximal or distal to the elbow? What will be the answer? Yes, the correct answer is distal. Now let's understand body planes. Body planes are imaginary lines or imaginary flat surfaces that divide the body into different sections. Okay, these planes help doctors study anatomy and interpret X-rays, CT scans, and MRI scans. So the first plane is sagittal plane. Sagittal planes divides the body into right and left parts. So this green one here, the color mentioned here is wrong. Sagittal is the green one. Okay, so it divides the body into left and right parts. The second is coronal or frontal plane. It divides the body into front or back, the blue one here. The third is transverse plane, red color. It divides the body into upper and lower parts. So these 3 planes are very important in anatomy and medical imaging. Whenever you see the scan, think about which plane it has been taken in. Okay. So remember the trick. Sagittal is equals to left and right. Coronal is equals to front and back. Transverse is equal to top and bottom. Okay. Finally, let's understand some common body movements. The first movement is flexion. So flexion means bending or decreasing the angle between the two bones. This arrow mark will show the angles. Okay. So flexion means bending or decreasing the angle between two bones. For example, when you bend your elbow, that is flexion. Now look at the next picture. Extension means Now look at the next picture here. Extension means straightening the joint or increasing the angle. Here in the picture you can see when you straighten your elbow, that is extension. Okay, next is abduction. Abduction means moving a body away from the midline. Okay, for example, lifting your arm sideways away from your body. Okay, the opposite of abduction is adduction. So adduction means bringing the body part back towards the midline. Okay, these movements are very common during physical examination and physiotherapy. So as nurses, we use these terms regularly with patients. Okay. So easy trick to remember this all is very, very important. Abduction is equals to away. Adduction is equals to add back. Okay. So this tricks helps many students remember these terms. So remember. Next, let's see the now let's see how this knowledge is used in real nursing practice. Okay. So this is called as clinical correlation. Clinical correlation means connecting the anatomy with the patient care. Okay. So look at the picture on the right side. The nurse is helping a patient move the leg here. So this procedure is called range of motion or simply RM exercise. So range of motion means, what is range of motion? It means moving a joint through its normal movement. Okay, for example, the shoulder can move, the elbow bone can move, can bend and straighten. The knee can also bend, right? And it can also straighten. So this movement help keep the joints flexible. So why this ROM exercise is required? It is very important for patients who cannot move by themselves. For example, which type of patients cannot move by themselves? Like some bedridden patients after surgery. Okay, patients with paralysis or elderly patients. Okay, now look carefully at the nurse hand. One hand is supporting above the joint and other hand is supporting below the joint. Okay, this is very important. As nurses, we should always support the joint properly before performing any ROM exercises. So this prevent pain and injury in the patients. Always remember, never pull a patient's arm or leg forcefully. Okay, support the joint and move it gently. So this is a common practical skill that every nursing student should know. Next, now let's look at some common university exam questions. These questions are very important and asked almost every year. The first question is, define the musculoskeletal system and list its component. So this is usually a 2-mark question. Always start with one clear definition, then the list of the component, and then the second question is, explain the function of the skeletal system. Okay, this is usually a 5-mark question. Write each function separately, which we have seen, and explain it in 1 or 2 lines, each function. Okay. The third is anatomical position. So very, very important. Remember the 4 important points which I have told. What it is: straight, standing upright, face forward, palms facing forward, and feet should be parallel. Okay. Then the fourth question asked is the difference between proximal and distal or medial and lateral. So whenever you see the word differentiate, uh, please draw a table with 2 columns. This makes your answer neat and easy to understand. Okay. Finally, the last question is, you may be asked the write short notes on body planes. So remember all 3 planes and what they divide. Okay. Sagittal, coronal, and transverse. If you prepare these questions well, you can score very good in anatomy. Now let's quickly test what we have learned. Question number 1 is, which plane divides the body into left and right halves? Take a moment and think. So what is the correct answer? The correct answer is sagittal plane, as we have seen before. Here, sagittal plane is green color. Okay, it divides the body into right and left sides. Now, question number 2. What connects bone to bone? The answer is ligaments. Okay. Next, question number 3. Moving a limb away from the midline is called what? Away from the midline, as we have seen the diagram, moving the hands away from the midline. Okay, that is abduction. And the last question, the wrist is proximal or distal to the elbow. Okay, here also diagram is there, no? So the wrist is proximal or distal to the elbow? It is distal. Okay, very good. If you answer all 4 questions correctly, it means you have understood today's lecture very well. Okay. Now, before we end today's lecture, let's quickly revise the most important points. Number 1 is the musculoskeletal system is made up of bones, muscles, and joints. Okay, together they provide support and movement, protection. Number 2, anatomical position, very very important. So anatomical, what is an anatomical position? That 4 points you have to say. Next is directional terms. So and body planes, body movements. So these are the basic language of anatomy. Without understanding these terms, it would be very difficult to study the body system. Okay. Number 3 is, as nurse says, anatomy is not just a theory concept. You will use this knowledge while moving patients. Okay, performing physical assessments, giving injections, and preventing injuries. So always try to understand the concepts, not just memorize them. So these are the 3 most important points from today's lecture. So that brings us to end of today's lecture. So today we have learned about the musculoskeletal system, its components, its function, its importance in nursing, and anatomical position, directional terms, body planes, and body movements. So these concepts are the foundation for all future anatomy topics. Okay, so in our next lecture we'll study bones in detail, and we will learn the functions of bones, types of bones, their structure, and their clinical importance. So make sure you revise today's concepts before watching the next lecture. Thank you for your attention. And if you found this lecture helpful, please like the video, share it with your classmates, and subscribe to the channel for more nursing lectures. Okay, thank you. I will see you in the next class. Have a great day.